Hello, everyone. There's a viral TikTok video circulating on social media in which someone who was reported to be a doctor claimed that President Trump has congestive heart failure, chronic kidney disease, and 6 to 8 months to live. I first saw this video on Reddit yesterday on a post entitled, MD says Trump has 6 to 8 months to live, CHF and CKD. It's been posted to a number of other subreddits with thousands of upvotes and thousands of comments. And there's been at least one semi viral video on YouTube about it. But here's the thing, there are so many problems with this TikTok video. First of all, the man speaking is not an MD, but is instead a physical therapist. Now, there's absolutely nothing wrong with being a physical therapist, but diagnosing heart failure and kidney disease is not within their usual scope of practice. For the record, as far as I can tell, he's never claimed to be an MD himself, but this is misinformation embellishment on the part of the presumably unrelated anonymous Reddit user who initially posted it, and who had selectively edited out the line when the man identifies himself as a PT. And that's kind of a crappy thing for the Reddit user to have done, because now most people who have reposted or commented or shared the video have uncritically accepted the MD claim. I am a medical doctor, someone who does routinely diagnose heart failure and kidney disease, and I've talked about Trump's health before on this channel, but I have never made any specific diagnoses because we can't. The things asserted in this guy's video are excessively speculative, and some of them are just not true. The video is pretty short. I'm going to play it in its entirety, but I will interrupt it with some commentary as we go. I thought about blurring the guy's face because I don't want him to get brigaded by either the left or the right, but it's already all over the internet, and these claims of his are not just a one-off. He's made similar presumptive claims about Trump's health multiple times online before.
The president's congestive heart failure is getting worse. I'm a home health physical therapist with a doctorate in my field. I see congestive heart failure patients on a daily basis. The reason I know that he has congestive heart failure is because of the swelling in his feet and ankles.
First, there are many causes of ankle swelling. Yes, heart failure is one of them. So is chronic kidney disease. But so is a relatively benign and very common condition called chronic venous insufficiency, which is what the White House has reported to be the cause, and is completely plausible. And ankle swelling can be also from chronic liver disease, like cirrhosis, or from something called nephrotic syndrome, in which the kidneys inappropriately allow protein to leak into the urine. Various medications can cause swelling, including ibuprofen and a class of blood pressure medications called calcium channel blockers. And there are still plenty of other causes. The point here is that it's not possible to conclude just from photographs and video that a person has heart failure or kidney failure.
And the reason I know it's getting worse is because he's sitting behind the desk on camera now. He lashed out against MSNBC for giving him hash about his ankles. This is how we know that something is true, because it gets to Trump. Remember recently where he was talking about going to heaven for some fucking reason? He says, people said I'm not doing very well. I don't think he's talking about the media. I think he's talking about the doctors who are treating him. The only reason his health has been maintained at all is because he has the privilege of getting IV diuretics, spironolactone, Lasix, Bumex, something like that.
So now about diuretics. First of all, there is no IV spironolactone. It's available as an oral medication only. When I watched the edited version of this video, this was the moment that I started to suspect that he was not actually a medical doctor. Second, getting IV diuretics is not therapy only available to the elite, as he's implying. Literally, anyone in the country, as the United States, who has heart failure severe enough to benefit from IV diuretics over oral diuretics can come to the hospital, be admitted, and receive IV diuretics. As a hospitalist, they are among the most common meds I prescribe.
That's why his hands have been bruised and covered with makeup. Badly, I might add.
Speculation that the bizarre and poorly applied makeup to his hands is to hide bruising related to either IV sites or anticoagulation is not unique to this one video. I have no idea why that makeup is there, or why a billionaire president apparently can't find a makeup person who can match his skin tone, but I actually don't think it's from an IV. Given Trump's desire to portray a tough guy image, I would think that he would insist on IVs being placed higher in his arm, where bruising would not be as easily visible. I know sometimes in the hospital, patients do end up with IVs in the hand when the nurses can't find another location, but there's almost always a vein elsewhere that can be found. If not found by routine inspection and exam, then found by ultrasound or some other piece of technology. This is a common practice for everybody these days, not just billionaire presidents, which is why hand IVs are actually much less common now than they were when I first started practicing 20 years ago.
Oh, he also has chronic kidney disease, which is also contributing to the swelling in the feet and ankles.
Once again, there is no way for this guy to know the state of Trump's kidneys. He certainly could have chronic kidney disease. CKD is common in the elderly, but concluding that based on just on the man's ankles.
I can't tell you how many times I have seen a patient in their home because they were hospitalized for AKI, or acute kidney injury. And the kidney injury was caused by nephrotoxic medications, namely diuretics, spironolactone, Bumex, Lasix.
So maybe this is semantics, although I don't think it is. But referring to diuretics as nephrotoxic is a mischaracterization. Yes, some layperson facing websites make this claim. And yes, diuretic overuse can lead to renal failure. But that's because of dehydration caused by overuse of the medications, not because these medications are pharmacologically directly toxic to the cells of the kidney. Calling them nephrotoxic is not really an accurate way to think about this class of medications.
The president is definitely getting sicker, and we know he's not going to change his diet because he's such a fucking idiot. I think he's going to be around for 6 to 8 months tops. Thank you for your attention to this matter.
So that's where this viral video abruptly ends, with the physical therapist claiming that Trump has 6 to 8 months left to live. Even if a physician had access to Trump's entire medical history and could directly examine him and could order whatever additional tests they thought indicated, it would not be possible still to give such a precise prediction about his life expectancy. There are patients of mine with metastatic cancer for whom I see their CT scans and their blood work. I know which chemotherapy regimens they have or have not responded to. And even for these patients, I would not offer a prognosis so specific because medical doctors are just not that good. Now, I can say that if I had 100 patients with an identical medical history and set of findings, how those 100 patients would do on average. But predicting the course of any one specific patient is impossible up until the patient has the point at which the patient has only a few weeks or less, when our predictions do become incrementally better. There are signs that Trump has medical problems that he has not publicly disclosed. I've talked about these before. For example, a year ago, I discussed the fact that Trump's unusual use of language is consistent with some kind of slowly progressive neurocognitive disease. But despite the overwhelming amount of video of Trump, without examining him and without having access to his medical records, we can't be specific about what his specific problems are, including whether or not he has heart failure or chronic kidney disease. And we definitely cannot predict how long he has left to live. No one can. A lot of people who dislike Trump liked and shared this video because it played into their biases so well that they didn't think about whether or not they should be skeptical of it. Finally, I promise that the next video on this channel will not mention politics or politicians in any way whatsoever.